Dima Uthma Umar on lead poisoning in the country.
Globally, lead exposure remains a significant public health concern. The World Health Organization emphasizes that there are no safe levels for lead. But in spite of this, many products on the market that are used on a daily basis still contain unsafe levels of lead. In light of this, the Ministry of Health has issued a stern warning for local manufacturers to label products with components of lead.
This exposure can lead to serious health issues, including cognitive impairment, developmental delay, and behavioral problems. These are just statistics. They represent the lives of children whose futures are at risk due to preventable exposure.
Head of Quality Management Unit at the Ministry of Health, Selina Duse, highlighted the importance of protecting children from lead poisoning.
This awareness week on children, because children are vulnerable. They don't have grown lungs, they are not grown. When we say grown, mean that all their body parts and then even their organs in the system are not well grown and not well developed. And so anything that affects them at that younger age affects their developmental stages.
Mercury is also heavy metal. The water, the soil is passing through areas which they are contaminated. It means the lead will go into it. So if you are drinking contaminated water, know that you are going to be affected by it. You have children play with certain toys, right? They contain also lead. So we need to be careful about the toys our children play with.
Well, so we need to be careful, but are we being careful? What measures are we taking, and how serious is the situation? We'll be having that conversation now. Like I said earlier, I've been joined in studio by the President and CEO of Pure Earth, Andrew McCartor. Andrew, welcome.
Thank you. It's a pleasure to be here.
Absolutely. How are you doing?
Oh, wonderful. I love coming to Ghana. This is my second trip. Always a pleasure to be here.
Right. And how is Ghana treating you? How are we welcoming you?
Lovely country, hospitable people, wonderful culture, food. I love it.
Amazing. Well, even as we're talking about the wonderful culture, the lovely people, the wonderful food, which one have you tried, by the way, the food?
What's that?
The food. Which one have you tried?
Oh, I like jollof. I like all of it.
But then there's a cause for us to also be quite cautious about how things are happening because of our own activities in some cases. Illegal mining taking a toll on us. We're seeing heavy metals, mercury, lead. And so your visit comes at a very important time. What really are you hoping to achieve with this visit?
Yeah, thanks. So we're here to really expand on years worth of work that we've been doing with the government of Ghana. And the good news is that while Ghana faces challenges, the government of Ghana is aware of these challenges and has been very proactive and collaborative with us, going all the way back to 2007 in the case of Pure Earth. But what we're here to do now is to expand that work.
Okay.
We know that Ghana has challenges. The government knows that, and we're really fortunate to have the opportunity to grow the type of work that we've been doing nationally, and to really create a robust response that meets the scale of the challenge. So what we've done to date is build the evidence for action, to understand the nature of the challenge, to demonstrate solutions, and now it's time to scale all that up.
And so in terms of the work that you're doing, you say you've been laying the foundation basically, and you're going to improve on that, scale it up. What are we looking at?
So on lead pollution and lead exposure side, we've conducted a lot of assessments of exposure levels, how much lead is getting into children's blood. But we haven't done a nationally representative survey of children, and now we have the opportunity to do that in the coming years. That's actually very unusual for a middle-income country like Ghana to undertake. Ghana will be one of the first in the world to do that, and it's incredibly powerful data in terms of designing solutions. But at the same time, we're going to be assessing environmental conditions, contaminated sites, water bodies, food systems. We're going to be assessing consumer goods in markets. Items in people's homes like medicines and spices and things like that, to understand not just how much lead is in kids' blood, but why is it there and where is it coming from? And of course, both of these things help us then work with the government to design solutions. How do we get it out of consumer goods? How do we get it out of food?
That's quite exciting. But let me bring also into the conversation this morning Reverend Dr. Esmond Quansah. He's the Africa Regional Director, also Country Director for Pure Earth. So based on the work that Pure Earth has done over the years in Ghana, where would you say, how dire is the situation currently, really?
Yeah, thank you, Joshua, for having us here this morning. I would say that the situation is concerning. The situation is alarming. But I must also be quick to add that we see a lot of determination from the various governmental agencies. The government of Ghana has always been proactive to collaborate with us.
Right.
Since the inception of Pure Earth work in Ghana, from the Gbogboloshi days, the e-waste project, all the way down to the current project that we are running, we are doing that with the government agencies, and they have shown determination to address the issues. And Pure Earth is working to provide capacity and funding support to be able to address the issues head on.
Interesting. But Andrew, we know that there's the National Lead Technical Working Group that will be inaugurated today. Really, what role will Pure Earth be playing to also ensure that you're supporting this advisory body to deal with the issues that confront us?
Yeah, we're delighted at the launch of the working group, and particularly that Ghana's Environmental Protection Agency is leading that group, because our philosophy is that Pure Earth wants to be in a supporting role, provide technical support, provide financial support, but it's important that the government take the leadership role. And that's also the philosophy of our donors. So EPA has stepped up to take leadership of this. It will be a coordination agency. So we all understand what our roles are, what we're doing, that we're working in concert with one another, and that always the government is the front line and leading this action, and that the international partners are behind them in a supporting position. We think that that's important for sustainability.
Right. So that when the government takes the lead, it becomes a government project with support and technical expertise from groups like Pure Earth.
Exactly, yeah.
Right.
And so that means that, what we don't want is for an international group to come, do some activities, disappear, and not leave anything lasting. And in this way, everything we do will include government training, the provision of equipment to the government that lives in the ministries, in the agencies. So that even if we were to go away one day, the government would be in a much stronger position to continue taking that leadership role to address these challenges.
So interestingly, in your submission earlier, you mentioned that you're also looking at foodstuff, even medicines, to get to understand, as part of the scaling up, to get to understand exactly why the lead is there in the first place, even though studies have shown that, yes, we're seeing traces of that in children, for instance. What, in your estimation, would be the biggest barriers to actually clamping down on lead getting to where it should not get to?
Yeah, so lead is not needed in very many products. So if we take, for example, I don't know if you've seen children wearing an eyeliner, particularly in the North and in Muslim communities, children will wear this black eyeliner.
Yeah.
There's no reason that lead needs to be in there, but it's in there.
It is?
It is.
Because I think I recollect that it said it's used to protect their eyes rather.
Yeah.
In some strange instances.
And this isn't the only product. There are many products where lead exists in the product and it is absolutely unnecessary. So one of the challenges is working with industry to get them to change their formulations of different products. And that's a challenging thing. Industry is used to doing things their way. But also there are other causes of lead exposure and pollution, like car battery recycling. Those heavy plastic boxes that are in every car and motorbike, that's filled with lead plates and acid, and if that battery is recycled informally or unsafely, it can create tremendous pollution. So now we have to work with industry and regulators to make sure that the incentives on those industries are correct so that they're recycling safely with proper pollution control. So each source of lead exposure requires a totally different solution, but it always involves the public sector, the private sector, and civil society like us.
Reverend, you are here with us. You know exactly how big these industries are.
Yeah.
And so clearly getting the mind shift of these industries is not an easy thing to do. How much of a challenge is it, for instance, when it comes to recycling these batteries, to say that let's not do it the way we are currently doing it because of the challenges that it poses to us?
Yeah, thank you very much, Joshua. I think it's as you put it, it's an issue of concern to everyone, and the scale of the issues are huge. Given the work Pure Earth has done so far, the evidence we've gathered, of course, in consumer products, for example, you're talking about cookware, our daddy sayings that we eat from.
Yeah,
we found alarming levels of lead concentrations in this products. We've also seen, of course, the eyeliner he's talking about, the toys, and all these things that we're talking about are all concerning. What POED is doing in collaboration with the various authorities, Ghana Standards Authority, Ghana Environmental Protection Authority, is to undertake a value chain analysis of this product. We're also documenting the stakeholders that are involved in these processes in order to design regulations to be able to address these issues head on. Just this afternoon, our president will be signing an agreement with Ghana Standards Authority to develop standard for cookware. These are things that do not exist, and using this medium, we believe we'll be able to solve the issues once and for all.
But how has the conversation been like, especially with industry players who have, this is their market, this is what we're used to, we're not going to change. Changing will make us incur more cost and all of that. Exactly. How has the relationship been with them?
I received a call from Western Region some time ago when we broke the news about the design, and they reached out and was like, what were you saying? You were saying the designs that we produced contain lead,
which we used to cook everything here.
Exactly. And so
the jollof he likes.
Exactly. And so for them, you're trying to take our market away.
Yeah.
But what we've been doing with them is to have a conversation with them. Let them understand a safer way this could be done. And because there's no regulation in that sector, that is one of the problems. If there is proper regulation, there are proper standards and proper certification processes, these artisans will be provided training, and they will use the best methods to be able to manufacture this to prevent them from introducing lead unintentionally into the consumer product that we are using. So that is one of the ways that we are dealing with it. And then one of the projects currently being funded by Openfield is to actually do a deeper work around this area, map all those who are into the production, map all those that are into the value chain processes, and work with them to address the issues with the authorities that are concerned.
Quite interesting. Andrew, looking at fundamentally how our lives operate here, people are very used to certain things. So it's not just the businesses. Even if the businesses decide not to produce again, there are people who have these things at home, and that's what they use. So it all has to do with mindset, public awareness. How crucial is that, and what work is POED doing in getting to raise public awareness about these issues of lead poisoning, among others?
Yeah, so if a solution requires people to dramatically change their lifestyle, it's unlikely to be successful. But like I said, lead doesn't need to be in any of these products that we're all used to using. So rather than telling everyone to rearrange their whole life and behavior, what we'd rather do is work with producers to make sure that the goods that people like to use are just safer than they used to be. And this is really kind of a sustainable solution, because no one wants to drastically reorder their life. And I think that over the next years, us and the government will have strong financial support to do lots of public awareness, and we're going to generate a lot of data. So people don't have to wonder, am I safe? They don't have to wonder, what do I do next to protect my kid? They don't have to wonder, is product A or B safer? We'll be able to disseminate a lot of public education, do a lot of community awareness in industrial areas, teach people how to clean their homes, practice good hygiene to keep their kids safe. So I would expect a lot more public information to come out about all of these challenges.
Right. So on a scale of 1 to 10, where would you rate our level of public awareness when it comes to lead poisoning, for instance?
Well, public awareness globally around lead poisoning is at 1. It's an enormous challenge, and just very few people are aware of the scale. So Ghana's not unique in having low public awareness. That's the challenge we face everywhere. But what Ghana is unique in is an active government that understands the challenge and is proactively collaborating with partners around the world.
Right.
So Ghana, I think, is in a very good position to tackle this.
And talking about financing, because we know that sometimes for these projects, we need to invest heavily to be able to, one, create the awareness, to be able to move even producers from their current state to a safer state, among others. Really, what's the state of that?
So we have 4 years of secured funding to keep pushing forward on this, which in international development projects is quite a long period of time.
4?
4 years, yeah. So, and we've been working since 2007. So we're kind of in the middle of this progress, but we really have a strong financial foundation, wonderful MOUs being signed with relevant agencies. We're going to be doing a lot of surveillance of health, a lot of surveillance of goods, but most importantly, the development of solutions with the relevant government partners. And that's where the rubber meets the road and impact starts to really happen.
And that's how sustainability also kicks in, because, I mean, there have been concerns. I remember that when USA decided that, well, we're cutting funding, a lot of programs running here was like, whoa, we're dead, because that is our source. And there was no sustainability plan. But in working with government and putting the government in the forefront, that's how you're ensuring sustainability.
Yes, and we're bringing in equipment that will live in the ministry. So if we were to disappear for some unknown reason, they would have the specialized equipment. They would have the training. Right. They would have the strategies. They would be in the leadership position from day one.
Quite interesting. Now, let me come back to you, Reverend Doc. Globally, I want to find out the lessons that you've learned, because he mentioned that globally the awareness when it comes to lead pollution and poisoning is at 1 out of 10, and I'm alarmed. I'm really alarmed. But then what lessons have we drawn from other countries that say, you know what, based on what these countries are doing, this is how we can shape Ghana's policy to tackle these issues?
Yeah, so Joshua, PureEd has been, into this space for the last 25 years.
Right.
Work across 25 to about 27 countries, undertaking cleanups. I think we've done over 110 toxic site cleanup across the globe. These are valuable lessons that can be translated across to Ghana and across Africa by extension. There's an example of Georgia. I mean, PureEd has done an extensive work in Georgia in the past years, and they've been tremendous successes. When you go to Latin America, PureEd has been doing enormous work in that area. These successes, for example, could be translated to Ghana, and then Ghana is serving as a model for programming in Africa. And so our successes here as well will translate into the wider continent to be able to address these issues once and for all.
And what role is technology playing in all of this?
Excellent. So PureEd used the state-of-the-art equipment. So we have one called SRF, X-ray fluorescent. It's an equipment that, it's a tool that when you point it to a media, it will tell you whether it's mercury, lead, cadmium, or arsenic. That technology is helping in our work, and it's part of the equipment that will be donated to the government agencies that we will be collaborating with on the project that the president mentioned. We also have tools like Jerome. Jerome is able to tell the vapor, the amount of mercury vapor in the air. We use lead care kits to be able to test for instant blood lead level in children. So these are all technologies that we are employing to be able to address the issues as they emerge.
Quite interesting. Well, Andrew, let me come to you. Let's look at what will be your message to Ghanaians out there. Especially in light of the work you're doing and the times we find ourselves in. Government says it wants to clamp down on illegal mining, clean up, and all of that. And that's where your expertise also comes to bear. So what will be your message to Ghanaians and policymakers?
Well, first of all, my first message would be there isn't a need for personal panic. Ghana is a relatively healthy country, and at the individual level, people shouldn't be terrified. There's a need for urgency, particularly in kind of government action, but the individual should not be panicking about their own safety. Second message would be, rest easy in the fact that your government is more proactive than most. That Ghana, as Dr. Quansah said, is a leader in Africa, is demonstrating models that will be replicated in your neighboring countries. But then third is look out for public guidance about how to protect your family, because we can all increase our safety. So things like I mentioned, personal hygiene. If you live in an industrial area where you think chemicals are being used, make sure your children are washing their hands, and if they're walking outside barefoot, washing their feet before they come in. Wet wash your floors and furniture to pick up dust. Dust can carry these chemicals like lead. It comes into the home in dust, then children touch that dust, they put their hands in their mouth, and that's how children are often exposed. So there's little things that people can do to protect themselves every day. Look out for public guidance on which products contain these harmful chemicals. Skin whitening creams often contain mercury. Be careful with that. Look out for public guidance about which eyeliners contain lead and which ones don't. All of this should be emerging over the coming years, so look out for these kinds of public information.
So we should be very curious about it and try to get more knowledge.
Absolutely.
To live safely.
Yeah.
Interesting. Reverend Dr. Esmond Quansah, your words.
Yeah, so I would just want to reiterate what the President said. POED is committed to partnering with the government agencies to be able to address these issues. There's no panic. Our government has been a lot more proactive than a lot of governments in Africa in trying to address these issues. Just to mention that there are a lot of studies ongoing currently. There's one to identify the impact of mercury in food crops, for example. We're also running a randomized controlled trial in the northern region to understand the contribution of some of the leaded consumer products in blood level in children. So these are all designed and in a way to understand the issues and design interventions that would address them. And we are doing this with government agencies. So rest assured that there's something being done about this, and I'm sure very soon we will see some of the successes.
Gentlemen, it's been a pleasure having you, and I wish you all the best. And we're also here to always support with the advocacy when it comes to these issues. Right. So, Andrew McCartor, he's CEO and President of Pure Earth. Thank you so much. Enjoy your stay in Ghana. I mean, it's the best African country. No, forget whatever you're told. And of course, Reverend Dr. Esmond Wisdom Quansah, who is the country director for Pure Earth. It's amazing having this conversation with you. But the key thing is, let's always seek knowledge on lead and practice personal hygiene. That's my takeaway for today.
Thank
All right,
you so
guys,
much.
do have a wonderful day.
Thank
and
you.
Yes, you're still tuned into the Morning Star here on Star 103.5 FM with me, Joshua Kojo Mensah. We'll be right back with the trends and more. Stick and stay with us.
Let's have breakfast.